Go.
Hello, dear friends. It's Dr. Greg again. Today I want to talk to you about birth preparedness. As a pregnant woman, one of the things you're looking forward to is that big day when the baby will come out, when you come face to face with your baby, that precious jewel that you'll be carrying for about 9 months or thereabout. How do you prepare for that day, that big day? That day should not just happen to you like something that wasn't planned, because you've had 9 months and probably even more to prepare for that big day. So I'm going to talk to you today about birth preparedness. What are the things you need to put in place as you plan towards your birth? I believe that from the first trimester, you should start thinking about that day. You should start thinking about your birth preparedness. But more importantly, as you move towards your second trimester or third trimester, that means when you are getting to maybe 6 months to 7 months of the pregnancy, or even earlier, or probably when you are like 24, 28 weeks, if you want to use weeks as a method of calibration, you should take your birth preparedness very seriously. What are the things you have to look out for? You have to sit down with your doctor to talk about this. Now, for some women, their pattern of birth is already known. Probably for women who are already being prepared to have an elective C-section. They're going to have a cesarean section. They know that already. So the things you're going to put in place is, what's the best time for you to have that elective cesarean section? You have to discuss that with your doctor. I mean, for most cases, when you are 37 completed weeks and above, your doctor probably will be sure of the date that is going to give to you. Then, alternatively, there may be reasons why they want to deliver the baby earlier, even if it's coming through a C-section, when they believe that the baby is mature enough. But that decision will be taken between you and the doctor. For some other women, they are going to go into labor, and labor, you don't really know when the actual time will be when labor will start. It's important for you to know what to put in place, when you are going to go into labor. Many maternity units, many hospitals will have a list of items they want you to put in place, a list of items that they're going to provide for you. That discussion you need to have with your doctor or with your caregivers as soon as possible. They need to put those things in place and you tick out those lists, those things that you need to get and prepare for. But it's also important for you to know the signs to expect when you are going to fall into labor. Apart from the fact that you may have these painful, sustained contractions that may last as much as, 10 seconds every 1 minute. You may have like 1 or 2 of those contractions, 10 seconds duration of contractions lasting every 1 minute. Maybe the contractions that you may feel, that is significant enough to be called labor contractions. Then those contractions normally occur when you are close to 10, when you're about 37 weeks of pregnancy. Also, if your water breaks, if you rupture your membranes, if your water breaks, that is an automatic sign for you to go to the labor ward. Or if you have passage of what we call show, mixture of blood and mucus together, you need to go to the labor ward to be evaluated. The doctor may evaluate you and ask you to go back home or stay behind. That depends on the findings that the doctor may or the caregiver may find when they are doing when they're evaluating your cervical parameters through a vaginal examination. So these are the things that you need to know about labor. Remember, keep a list of items that you need to prepare for. 2, know the signs of labor. 3, ensure that you have a ready and available means of transportation to take you to the birthing center as soon as possible. So do we meet again? Enjoy your pregnancy. Bye.